Hello, everyone, and welcome to our first seminar of the Surveillance Advances Series 2024 to 2025 season, entitled First Nations Data Governance and Public Health Surveillance in Canada, Insights, Lessons, and Future Direction. This seminar series is co-hosted by the Public Health Agency of Canada and the National Collaborating Centre for Infectious Diseases, or NCCID. My name is Signe Berger, and I am a project manager at NCCID. I will be your moderator today, along with Chayu Lin, who is a senior policy analyst in the Data Surveillance and Foresight branch of the Public Health Agency of Canada. NCCID is funded by the Public Health Agency of Canada to provide knowledge and evidence for use in public health planning, programs, and policies related to infectious diseases. We are incredibly pleased to be co-hosting this series with the agency. While we meet today on this virtual platform, I would like to begin by acknowledging that NCCID is hosted by the University of Manitoba, which is situated on Treaty 1 territory, the original lands of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and on the homeland of the Métis Nation. As a fourth-generation Icelandic settler, I am thankful for these lands that I live and work upon, and I recognize the responsibilities that I have inherited for their protection. As an organization, NCCID recognizes how colonialism implemented treaties and systemic inequities that were intended to benefit some while harming others. We are committed to working with our partners towards reconciliation, and we strive to honor the lands and their original caretakers in our work. Before we dive into today's seminar, there are a few housekeeping items that I would like to mention. A recording of this seminar and the presentation slides will be available shortly after the seminar on the NCCID website under webcasts. The chat box for participants has been disabled for this session, but the host will use the chat box to communicate additional information with participants. If you have technical problems with Zoom during the seminar, please just email us at nccid@umanitoba.ca. Please send us topic-related questions through the Q&A tab, and we'll try to answer as many as we can in the discussion period after the presentation. You can also like any of the questions to push them up in priority. We also want to note that Surveillance Advances is a Section 1 self-approved group learning activity as defined by the Maintenance of Certification Program of the Royal College of Physicians and Surgeons of Canada. This seminar series is also approved by the Council of Professional Experience for Professional Development Hours for members of the Canadian Institute of Public Health Inspectors. So if you require a letter of participation, please look out for the survey that will be shared after today's seminar.
Well, thank you, Cindy, for covering the key housekeeping items. Welcome and thank you for joining us today. As Cindy mentioned, my name is Chayu Lin, and I'm a senior policy analyst from the Data Surveillance and Foresight branch here at the Public Health Agency of Canada. I would like to take this time to acknowledge that I'm joining you today from Dundas, Ontario, the land where I live and work. Situated upon the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississauga peoples. This land is covered by the Dish with One Spoon, One Pound Bill Covenant, an agreement between the Haudenosaunee and Anishinaabe to share and care for the resources around the Great Lakes. Today, Dundas and the city of Hamilton are home to many Indigenous people from across the Turtle Island. We honor the Indigenous people who have lived on and cared for this land for generations. As a first-generation immigrant myself, I'm grateful for the opportunity to share and call this place home. The seminar series have participants and presenters joining us from coast to coast to coast. The land in which they and you join us from represent the lived experiences of many Indigenous peoples, all within their own unique health story. We'd also like to acknowledge that the practice of public health surveillance may raise concern for Indigenous people and other communities. To public health professionals, Surveillance sounds similar to epidemiology, which is about understanding the distribution and patterns of the determinants of health and disease in population. But for others, surveillance may carry a negative connotation about security, privacy, and control. For this seminar series, we would like to know that we use the word surveillance to refer to the assessment of and response to public health threats as a core function of our public health systems. This seminar series is not just about the speakers or us, the organizers. It is about you, the audience. Your active participation, question, and perspective are vital to the success of this seminar series. We encourage you to engage in the discussion, ask questions, share your thoughts, and foster collaboration that can lead to the improvements in public health surveillance. Thank you.
Thank you, Chayu. So first, a brief update about our speakers today. Unfortunately, Marriott Sutherland is unable to join us today due to an unforeseen schedule conflict, but we are grateful to welcome Gonzague Guéranger from the First Nations Information Governance Center to join his colleagues Erin, Corston, and Maria Santos at today's seminar. So with excitement, I'd like to now introduce and welcome our speakers. Erin Corston is the Director and Executive Lead at the First Nations Information Governance Center, or FNIGC. She joined the center in 2019. Currently, her work focuses on advancing data sovereignty primarily through the implementation of a national First Nations data governance strategy. Erin believes strongly in First Nations' ability to harness the power of their data to create sustainable change at the local level where it matters most. Our second speaker is Gonzague Guéranger. Born in France, Gonzague moved to Canada in 1988 after obtaining a Master of Management Sciences from the University of Lille. He subsequently earned a Master of Business Administration from the University of Ottawa. Over the last 35 years, Gonzague has notably worked for the Bank of Canada, the Treasury Board Secretariat of Canada, Indigenous Services Canada, Crown Indigenous Relations and Northern Affairs Canada, the Treasury Board Secretariat of Quebec, and also in the private sector for Hewlett-Packard. As a senior executive, he has led several major transformation initiatives at the federal and provincial levels. Gonzague joined the FNIGC in January 2020 as implementation lead for the First Nations data governance strategy. He has since been fully dedicated to supporting First Nations in advancing their rights to self-determination. Last but not least, our third speaker is Maria Santos. Hold on, there's a quick issue with the slide deck here. Hold on. Okay. There we go. Sorry about that, Maria. My slides just disappeared on me. Maria Santos joined the FNIGC in 2013. She has been overseeing the First Nations Data Center and is also the lead for public health data initiatives with the organization. Prior to the First Nations Information Governance Center, Maria worked in the Northwest Territories as the territorial epidemiologist over a 10-year period. She also briefly worked with the Canadian Institute for Health Information and the Hospital for Sick Children in Toronto. A Filipino-born and raised in Toronto, Maria now lives and works in Ottawa on unceded Algonquin territory with her 2 teens, her husband, and mixed husky. She enjoys outdoor adventures and connecting with both land and water. Welcome, Erin, Maria, and Gonzague. We are so happy to have you join us today, and we're excited to learn about your experience and knowledge in First Nations data governance and public health surveillance in Canada. The floor is now yours.
So Maria is speaking first. Oh, there she is. Go ahead, Maria.
Am I? Oh, okay. I misunderstood. Okay. So thank you for that introduction, Sydney. So today we are, the title of our presentation is the First Nations Data Governance and Public Health Surveillance in Canada, Insights, Lessons, and Future Direction. So if you can change it to the next slide, Sydney. These are the learning objectives, which we hope to accomplish over this next hour, to develop a general understanding of First Nations data sovereignty and its relevance to Canada's health information and statistical systems, to better understand First Nations priorities as it relates to public health surveillance, and to support the vision of the First Nations data governance strategy. Next slide, please. So this is just a slide to declare that we have no conflict of interest. And next slide, please. Okay. And so with regards to FNIGC, I thought perhaps it would be good to start off before we go into our presentation, to situate the First Nations Information Governance Center and the work that we do to support First Nations in their pursuit of achieving data sovereignty, which aligns with their own distinct worldview. To understand why FNIGC exists, we'll start in the year 1994 when the federal government first made the decision to exclude First Nations people living on reserve from 3 major national population surveys. Concerned with the resulting data gap, First Nations advocates and academics came together to address this concern. In 1996, the Royal Commission on Aboriginal Peoples released its final report recognizing the need for First Nations to govern their own data. Later that year, the Assembly of First Nations formed the First Nation Governance Committee, whose goal was to create that national First Nations Health Survey. And it was this committee that later established the First Nations principles of OCAP. Then in 2009, the Assembly of First Nations Chiefs in Assembly passed resolution, which mandated the creation of the First Nation Governance Center as a standalone and nonprofit organization. FNIGC continues to lead the First Nations regional health surveys. We're currently in its 4th phase of data collection and steward the First Nations principles of OCAP. The FNIGC asserts data sovereignty with First Nations and supports the development of information governance and management at the community level through regional and national partnerships. We adhere to free, prior, and informed consent, respect nation-to-nation relationships, and recognize the distinct custom of nations. Next slide, please. So we currently have 10 regional members, 1 from each region, and our board of directors is made up of 1 director appointed from each region, as well as 2 non-voting directors from the Assembly of First Nations. Next slide, please. FNIGC is, sorry, can you go 2 slides back? And 1 more. There. FNIGC is committed to providing quality information that contributes to improving the health and well-being of First Nations. FNIGC and our regional partners follow established protocols, policies, and procedures that are guided by a holistic cultural framework and support First Nations governments to build culturally relevant portraits of their communities. We ensure that data gathering is done ethically and that First Nations communities are empowered to use their data for their needs through a wide range of work, including research, training, capacity building, and knowledge translation, even though our foundational work involved data gathering initiatives on reserve and in Northern First Nations communities. The FNIGC works closely with the regional partners across the country to develop and administer a number of regionally driven national surveys, including the First Nations Regional Health Survey, Regional Early Childhood Education and Employment Survey, the Labor and Employment Development Survey, and the Regional Social Survey. It works in coordination with our regional partners to provide oversight on the various surveys. FNIGC also conducts its own research that aligns with strategic research direction and our established principal priorities, leads education and training initiatives, and develop the fundamentals of OCAP course, which I highly encourage anyone working with First Nations data to take. It includes research into First Nations data sovereignty, information governance, and the development of First Nations-led tools and standards. And then we also have the First Nations Data Governance Strategy, which is a collective vision for the future as articulated by First Nations leadership, right holders, and data sovereignty experts. All of this work is guided by our 4 core strategic objectives. Our approach is community-driven and nation-based. Our data are inclusive, meaningful, and relevant to First Nations. Our tools are effective, adaptable, and accessible, and our partnerships connect regions to strengthen data sovereignty. So if you can please bring it to the next slide and the next slide after that. So today I'll be talking to you about public health surveillance as it relates to the pandemic in the First Nations context. From FNIGC's perspective, when the pandemic first started, we were asked by one of our regions to prepare some statistics to assist with their own emergency efforts. As a result, FNIGC quickly developed a report titled RHS Statistics for Shaping a Response to COVID-19 in First Nations Communities. This paper was intended to support emergency preparedness efforts by providing First Nations statistics on those factors that were related to the increased risk for infection and poor outcomes. The hope was that this data would support our regions when requesting funds to support their emergency response efforts. At the time, FNIGC was also collaborating on a paper with AFN that examined the challenges and limitations of First Nations COVID data. By providing the initial landscape for such data and data governance in the regions, the paper demonstrated how the First Nations data governance strategy, which was released around the start of the pandemic, could be a potential solution to address some of the significant health data governance issues impacting First Nations with respect to COVID-19 surveillance. During the pandemic, FNIGC also explored stewarding the national COVID-19 dataset that was residing and collected by Indigenous Services Canada. Knowing this data only represented cases among First Nations living on reserve, or more so communities that FNIB administers services, to include COVID-19 cases among First Nations living off reserve, FNIGC would need access to First Nations data held at the Public Health Agency of Canada and/or the provinces. In the end, FNIGC did not pursue this as it would entail a greater undertaking due to the number of agreements that would have needed to be in place. Next slide, please. So one of the main issues with the current federal, provincial, territorial health information infrastructure is that the data sources do not routinely, consistently, inclusively, or accurately gather identity information. Efforts that try to count the First Nations population and capture identity information can be unreliable. Without the ability to identify and count First Nations become invisible within health statistics. And without a true count of events such as cases, hospitalizations, deaths, or vaccinations, the distribution of the disease within First Nations could not be well understood, nor could we assess how well the healthcare system was administering to the population. For the most part, the First Nations population numbers have relied on 2 sources, either the census or the Indian registry. In addition to taking place every 5 years, the census does not include First Nations who decide not to self-report, nor does it include First Nations and communities who decide not to participate, Furthermore, it does not include those who are highly mobile, the homeless, nor individuals with lower literacy skills. As for the Indian Registry, it only includes status First Nations. It does not include First Nations who lost their status, non-status First Nations, or recent births. Without the ability to create reliable population counts, you thus end up with an unreliable denominator for calculating proportions or rates. And furthermore, to identify events among First Nations, the health administration system either relies on self-reports or linkages to the Indian Registry. However, due to distrust and experiences with racism, First Nations may choose not to disclose their identity. As a consequence, the identity information is not captured in the dataset. Furthermore, due to the stress and capacity constraints of the pandemic on the healthcare system, pursuing the collection of such missing information was not a priority. Another issue we heard concerning the data collected on First Nations regarding COVID is that it doesn't reflect community priorities and realities, and are of thus limited utility to the communities. Next slide, please. So after about 20 plus months of negotiating an agreement and meeting the requirements to receive the data set from Indigenous Service Canada, FNIGC started to receive weekly record level data from ISC from January 2022 to January 2023. For the most part, the ISC COVID surveillance data included First Nations living in communities for which ISC administered health services. Thus, there is a systematic exclusion of subpopulations of First Nations people according to their place of residence. For some provincial health administration systems, identification of First Nations can occur through data linkage to the Indian Registry. However, this excludes First Nations who are not registered, First Nations that registered after data linkage occurred, First Nations registered in other provinces and territories, and recent births, and may still also include those who are no longer alive. With such misclassification bias, whereby First Nations are misclassified as non-Indigenous, more so than the other way around, this can result in an underestimate of First Nations health and social inequities. And without this ability to identify First Nation, it makes it even more difficult to examine, monitor, and address disproportionate effects within certain subpopulations of First Nations, such as gender or people living with disabilities. Next slide, please. Historic and current jurisdictional complexities have been at the root of many of the existing deficiencies when it comes to First Nations data. For example, provincial, territorial health and public health departments, to various extents, have argued that historically and currently, Indigenous health, including Indigenous health surveillance, is a federal responsibility. This subsequently results in the underdevelopment of Indigenous health information systems at the provincial level. Furthermore, when provinces or territories have included Indigenous identifiers in their health information systems, they are not collected similarly across jurisdictions. Some are distinction-based, some are not. CIHI has tried to address such differences with the release of the Pan-Canadian minimum standards for collecting race-based and Indigenous identity data in health systems. In addition to the variability in the collection and reporting of data from provinces, territories, and federal jurisdictions, the data flow and limitations of the data in the different jurisdictions are not transparent or well documented in the public domain. Relationships are needed to understand the various nuances of these data sets. As a result of all these jurisdictional complexities, First Nations are included within two different but potentially overlapping data sets that contain gaps. Next slide, please. This non-integration of health information systems between federal and provincial health services and the mobility of First Nations between different jurisdictions on and off reserve or even out of province has resulted in challenges with notification and tracking and inaccurate counts of events. And since the two federal data sets cannot be linked, duplicates cannot be easily identified between the two data sets, further creating a fragmented and incomplete picture of COVID among First Nations. Next slide, please. First Nations face barriers for accessing data because the data is often under the control of provincial or federal governments and subject to the respective privacy legislation. Data sharing agreements and partnerships with First Nations and provinces and territories are key to facilitating transparency and enabling First Nations to be able to access their own data. But such agreements require significant effort, time, and collaboration, as well as capacity. For those First Nations that are able to enter into a data share agreement, there can be challenges and delays that result from trying to meet what is required by federal and provincial governments for First Nations to receive data, including privacy impact and security assessments, as well as communication between legal experts. These are, in addition to laying out the foundation for governance protocols and tools, can take many years before an agreement is signed. These challenges highlight the need to build federal, provincial, territorial, First Nations governance structures that support the flow of data and information and the ability to work across jurisdictions, especially during a pandemic. In the process of applying for access to the COVID-19 dataset with ISC, we had to apply under Section 82J of the Privacy Act for research and statistical purposes due to the legislative constraints. I had naively thought that MLISA would have enabled us to access the data. The application through 82J is not ideal for monitoring population health. Application for access must be tied to a specific objective. The use of each variable must be justified, and then the data set must be destroyed at the end of the agreement. Such data access management protocols are similarly applied by FNIGC when it comes to research projects wanting to access survey data at the data center, at the First Nations data center. However, this arrangement is unsustainable and unrealistic for First Nations that are trying to monitor its population health and administer programs. As we work towards devolution, data needs to be in the hands of First Nation governments so that they can immediately act upon it. First Nations need to own, control, and determine access and steward their data. Next slide, please. For those regions which have built the relationships, governance structures, and capacity to steward their information, they have been able to disseminate daily or weekly situation reports for COVID to their communities. But this capacity is currently unequal across regions, leaving some regions without information and thus unable to respond. Lastly, the lack of information for small communities due to measures for protecting individual privacy needs to be addressed. Of course, individual privacy is of utmost importance and needs to be respected. However, how does a community respond in the absence of information? We need to involve our First Nations in how data is put together so that it can still remain meaningful to them. This last slide lists some of the additional infrastructure and capacity challenges, thank you, with respect to COVID-19 data management. The lack of technological capacity to collect and use data, limited internet access, poor connectivity. For some communities, there continues to be reliance on paper-based records. The desire for enhanced data literacy, the need for human resource capacity and expertise, the high attrition of staff and turnover during the pandemic, and competing priorities such as wildfires and floods. So now I'm going to turn it over to Erin and Gonzague, who will tell you more about the First Nations data governance strategy, which describes this vision for the future.
Thanks, Maria. And I'll just take a couple of minutes to introduce an explainer video that the team will be playing in 1 second. So Maria has eloquently laid out some of the challenges we experience today, accessing quality data. And often the detrimental impacts of not having access to quality data, right? COVID-19 taught us a lot of things, but the biggest lesson we learned as First Nations was that we need to control our own data. We need to own and control its access and possession. We are more adamant about that today than ever before, and we are finally in a position to do something about it. With that, I'll play the explainer video, and after the video, my colleague Gonzague and I will then walk you through a set of slides, or potentially not. We're at the 1:30 mark, so maybe we can take another pause after we show the video and see whether we should go through the deck of slides or not. But we do want to delve a little bit deeper into the strategy if there is time. So with that, please go ahead and play the strategy, the video. Thank you.
For millennia, First Nations ways of living, knowing, and being were protected. Our languages, our identities, and our sovereignty thrived. We were safe, we were strong. But with colonization, our sovereignty and the right to determine our own futures came under threat. Control and ownership over our ways of knowing and being began to break down, creating a void between who we are today and who the Creator intended us to be. Yet despite these hardships, we are a strong and resilient peoples with a proud history and an even brighter future. In this era of reconciliation, a new story is being written. This story sees us taking back what is ours. It sees us exercising our rights to self-determination and self-government. But to do this, we must also exercise our rights over our information, over our knowledge, over our data. In a rapidly evolving digital economy, data in the form of information, statistics, and research is key. To date, Canada has been and is still collecting our data, comparing our quality of life, and planning our futures without our input or consent. We have been forced to fit into a mold that is not of our making or of our choosing. So we are at a loss for reliable, relevant data that speaks for us from our worldview. Our data must belong to us. It comes from us. It connects us. It defines who we are, and it has the power to guide us in building our future in our own image. It is our asset, our legacy. Like all governments in the world, our own governments must be empowered by reliable data to do their jobs, to make informed decisions and to plan for the future. For this reason, our leaders have been advocating for rights over our data. However, the recognition of our rights over data is not enough. We need to build capacities to meaningfully preserve and leverage our data in impactful ways. And although we have been collecting data, significant gaps remain, leaving many of our communities behind. That's why, as directed by Chiefs in Assembly, the First Nations Information Governance Centre and its regional partners developed a strategy from the ground up with the goal of building data capacities that our communities and leaders need. This strategy, our plan, is all about establishing fully functional, non-political, and expert-driven regional information governance centers, one in every region led by First Nations. These regional centers, or regional hubs, will provide a suite of shared data and statistical services to all communities, their governments, advocacy organizations, and service delivery agencies. Leveraging economies of scale in every region, communities and organizations will have access to the digital infrastructure and professional expertise they need to govern, access, and repatriate their data, leveraging its power. So what's next? Implementation will be community-driven and nation-based, rolling out in phases. Phase 1 starts now with the recruitment of a dedicated data champion team in every region that will engage leadership and help them define how these regional centers will be governed and what priority data capacities and services will they offer. To build a solid foundation, this first phase needs to focus on the blueprints before we start to invest in the brick and mortar. This work is expected to take about 3 years, with each region advancing at its own pace. Once completed, we will move to phase 2, and that's when we will bring our blueprints to life. Never has the timing been so right and the opportunity so within our reach. Our leaders have been trailblazing this path for years, and the Canadian government has responded with significant funding to implement our plan. With this strategy, we will build our own data governance and statistical institutions, and they will be equipped with the modern capacities we need to hold and use all our data. It will be our legacy for the next 7 generations to come. And the right to determine our own future.
Awesome. Thank you so much. So I just want to do a bit of a time check. It's 1:35 based on my clock here on Algonquin territory. Signe, I'm going to defer to you for direction here, if we should just go through the slides or whether we can stop here too and open it up for questions. It's up to you.
Well, of course, we would love to see the rest of your presentation and also get a chance to hear from Gonzague. So it depends, I guess, how long you think the presentation, well, whether it will go to the end of today's session and if we'll have time for just 1 or 2 questions, or
we can do
what
it.
do you
I think we can do it in 10 or 15 minutes, 10 to 12 minutes.
That would
Yeah.
be great.
Okay.
We would love to see the rest. Yeah.
Okay. We'll dive right in then. Awesome. Okay, so next slide. So what you're seeing here is basically a timeline. So with regards to the data governance strategy, we received a direction and a mandate from the Assembly of First Nations in 2016. And there's the resolution, there's an excerpt of the resolution there. The federal government responded in 2018 with a 2.5 million commitment to FNIGC to develop that strategy. So we did that. We submitted it in March of 2020, going back to the left-hand side of your slide. And then the federal government responded 1 year later with $51.5 million. So this is a big deal for FNIGC. This is the first time in history that we've been given an opportunity like this to build something as huge as what we're doing. Next slide. So this funding came to us through an initiative called the TAID. I'm not going to spend much time on this other than to say that the total amount that was committed by the federal government to Indigenous-led strategies was 81.5 million in total. And you can see on the left-hand side there, 59.5 of that went to the Indigenous First Nations, Inuit and Métis, and then 22 million of that stayed with ISK and StatsCan to do some work on their end as well. But I just do want to note that the Inuit and the Métis got 4 million each to develop their strategies, whereas ours was already developed, and so we're in phase 1 implementation. And so that's why the discrepancy in those numbers there. Next slide. So what you see here is, is the heart of the strategy. So if you do get an opportunity to check it out, it is on the FNIGC website. But those pillars that you're looking at the center of the slide are really so central to the strategy. This is where we've identified different areas where First Nations must build up our capacities. And in phase 1, you can see those 2 horizontal pillars. That's where the focus is in phase 1. We're building up our data governance, essentially answering how these centers are going to be governed. There's 10 regional centers, 1 national. How will those governing bodies look like? What authorities will they have? How will those governing structures be connected to the national? All of that right now is being worked out. In addition to the second pillar, some digital infrastructure and human resource planning is happening as well in phase 1. Next slide. What you see here is an example of what a typical center might look like. So you can see here that each center will have a governing body that will oversee and direct the work. There'll be an executive team like any, typical nonprofit organization. There'll be corporate functions. And those teams, of course, will deliver suites of data and statistical services that would be needed by communities and their client base, essentially. So like I said, one center will be established in every region to serve the data and statistical needs of communities, their governments, and their service delivery organizations in that region. Next slide. So we're often asked, what are you talking about? What data you're talking about here? Well, we're talking about all of the data. So we're interested in any data that is about us or that matters to us, regardless of where that data is held, whether it's on reserve, off reserve, whether it's survey data or administrative data, whether it's health, education, land, environment, housing, justice, etc. But essentially, what these centers will be set up to do will be to produce data that matters to First Nations. And I guess one more thing that I'll say here is that it's rights holders that will be driving the form and function of these centers in every region. And it will be rights holders who will determine the priorities that the centers will focus on first. And so we've got a list there of priorities that have emerged already in the work that we're doing. And these are the things that are important to First Nations. Next slide. This is the last slide I'm going to share before I hand it over to my colleague Gonzague. And what you see here is the data users landscape. So essentially, these centers will be set up to serve primarily rights holders, First Nations rights holders, so communities, as well as all of their organizations, service delivery organizations, and advocacy organizations, and what we're calling those circles, I guess so you could say, on the left-hand side of the slide is the First Nations ecosystem. Now, this is a lot bigger than some people might assume. We have students at FNIGC every summer, and a couple of summers ago, we had the students focus on documenting all the First Nations-led organizations in Canada, the First Nations ecosystem. There are about 1,800 of First Nations-led organizations in Canada. So these are essentially the future client base of these centers, second only to the First Nations communities themselves. And then on the right-hand side of the slide, you can see another set of potential future clients of these centers, of this network of centers, and those are the non-Indigenous entities in Canada, like, the FPT governments, researchers like yourselves, academic community, etc., that will also be very interested in engaging with these centers. And next slide, I'll pass it over to my colleague, Gonzague. I apologize for rushing through, but we'll get there. Gonzague, go ahead.
Excellent. Thank you very much, Erin. I'll try to be as well short. I think I have only three slides here. So what you see in the coming slides is a good example of the kind of transformation that we have started to implement as part of phase 1 of the implementation of the First Nations Data Governance Strategy. And that example is about what we call the First Nations Health Data Clearinghouse Table. We just created it a few months ago with Indigenous Services Canada and several other federal departments and First Nations land organizations. And let me explain a bit the context within which we have created that table. As you know, the federal budget 2023 and budget 2024 have set aside over $200 billion over 10 years to modernize the Canadian health sector and services, including the health information systems. And to do that, Canada and the provinces and territories have established a series of federal, provincial, and territorial committees and working groups to govern that reform. Now, of course, for the First Nations, the big challenge is that, as you know, we don't have most of the time the capacities to be really engaged in a meaningful way and also to inform and lead the change that impact First Nations. So that was a big issue. And in the context of the reform of the health information system, we wanted to leverage the implementation of the First Nations Data Governance Strategy to help address that issue of lack of capacities. Because as Erin mentioned, and as you saw in the video, this is all about building fully functional centers that will provide data and statistical services to communities and their organization. And those centers could play a key role eventually in the future to modernize the health information systems. So for these reasons, we have created what we call, as I said, the First Nations Health Data Clearinghouse Table to address this issue and identify the capacities that we would need to build within the centers eventually to make sure First Nations can contribute to and benefit from the reform of the health information systems. Next slide, please. Here on this slide, you see a little bit more concrete information about the Health Data Clearinghouse Table. On the left-hand side, you can see the list of all the federal partners that are at the table. We have, of course, Indigenous Services Canada with the First Nations Inuit Health Branch. We have Health Canada. We have the Public Health Agency of Canada. We have Canada Institute of Health Information, also known as CIHI. We have Canada Health Infoway. We have Health Workforce Canada, which has been recently established to modernize how we plan health workforce in Canada and how we support the health workforce. I think COVID-19 was clear about the lack of having the right skills, the right place to cope with the challenges of the pandemic. And then we also have Statistic Canada. So you can see we have really big players sitting at this table. On the right-hand side, we obviously have the First Nations Information Governance Centers, but also other key First Nations-led organizations that have a national mandate on health matters. So we have the Assembly of First Nations, we have the First Nations Health Manager Association, we have potentially the First Nations People Wellness Circle, and we are looking at collaborations as well with the National Collaborating Center for Indigenous Health, which co-hosts this session today, and then the Thunderbird House. For the last two, we still need to validate their participation. But the key message is that we have really, for the first time, a kind of a groundbreaking, innovative mechanism to bring all the parties together so that we can break the silos. And the table is really aimed to act as a catalyst to integrate all the different reforms underway or initiatives or projects so that we can have a good look at the big picture of what it looks like and how it may impact First Nations, and also how First Nations would or could participate to drive also the change. And part of the table outputs will be to map out the health information systems from a First Nations perspective to identify the gaps, whether the gaps are about data gaps, whether the gaps are policy gaps, legislative gaps, or capacity gaps. And then the purpose ultimately of the table, the ultimate outcome will be to identify those priorities that where we want to intervene through the strategy to close the gaps by building capacities as part of phase 2 and phase 3 potentially of the implementation of the strategy. The goal ultimately is to move toward a more inclusive, equitable, and responsive health information systems across Canada that will ensure that First Nations people living off and on reserve get access to the information they need, and more importantly, the health services that they are entitled to. Next slide, and last slide, please. So it's a lot of information that we've covered, Maria, Erin, and myself today. Maybe your head is a bit full, but we'll take a chance and ask you to raise any questions that you may have about the strategy, about COVID-19 and the lessons learned. With respect to the strategy, you can also cover your own experiences or comments regarding the data gaps, your experience about managing your responsibilities within the OCAP principles when you deal with indigenous people, and also talk to us eventually about the challenges that you have with accessing First Nations data. So these are just quick examples, and I'll stop there, and we thank you very much for your patience and having listened to this presentation.
Well, thank you, Erin, Gonzague, and Maria, for such an informative and insightful presentation on the First Nations data governance and public health surveillance in Canada. We will now start our discussion period, and we invite people to start asking questions in the Q&A. You can also upvote other people's questions. Given the time, there are already 2 questions in there, so we're going to start. The first one is from Justin. What do you see as the major differences between the FNGIC, Innu, and Métis data strategy, acknowledging that the latter 2 are just currently under development?
So I'll attempt to answer that question, and then I'll pass it on to my colleagues if they have anything to add. So it's terrible to say, but I don't know a lot about the Métis or the Inuits data governance strategy. However, we did provide support to the ITK during the development of their strategy. I think we spent 2 or 3 sessions with them, helped them understand, how we went about, ensuring that we, had buy-in, how we worked with the board to make sure that, the strategy met their vision and aspirations, how much engagement that we did to make sure that we captured some key pieces coming from the ground. And then, obviously the focus on the capacity piece, I think resonates with Métis, Inuit, and like all of us. I think that's the biggest issue, is we need to build up our capacities to be able to implement OCAP. And essentially, we're talking about this strategy as the operationalization of those OCAP principles, because this is actually putting, rubber to the road. This is, we need to have the capacity to be able to own and control our own data. So Gonzague or Maria, do you have anything to add in terms of the Métis and the Inuits strategy?
I think one thing that could be of interest to the audience is that, as you probably know, but just in case some don't, there are some big differences between the Métis, the Inuit, and the First Nations, obviously, on many factors. But from a First Nations perspective, we have what we call the reserves. As you know, these were created through the Indian Act and other things like that. And the challenge for First Nations is to serve their people that lives on reserve and off reserves, while the services on reserve are provided by Canada. The services off reserves are provided by provinces and territories. Mm-hmm. And that is a big difference relative to the Métis and Inuit. And it adds a fair amount of complexity that we already see almost every day in the implementation of that strategy. So I wanted to just share that thought, because it's one of the differences. But at the end of the day, as Erin said, all the 3 distinct groups face the same challenge, which is about having data governance capacities for data, capacities for statistics and research. And every of the distinction groups will pursue in their own way, building those capacities for them in a manner that meets their needs.
Maria?
I guess for me, it's definitely recognizing that the histories are different. And because of that, even like, for example, with Métis, the way that they're able to count their people is different from the way we're able to count First Nations. And so it's, and so there's going to have to be differences in which this is going to be implemented or will work itself out. So recognizing, yes, that definitely there needs to be these three different strategies because the histories are different.
Thank you very much. I see that we do still have other questions, but I'm concerned about the time that we have today. So I think as the organizer, we'll try to see if we can convey some of the answer to our audience in a different format. But for now, I want to say thank you, Erin, Maria, and Gonzague for your thoughtful responses to the first question. And I'm going to pass it on to my co-moderator, Sydney, for the closing remark. Thank you very much.
Thank you so much for your wonderful presentations today. And that concludes today's seminar. A reminder that the recording of today's seminar and the presentation material will be available on the NCCID website in a few weeks. And please join us for our next seminar next month on Tuesday, October 29th from 1 to 2 Eastern Time on cancer surveillance and the Ontario Occupational Disease Surveillance System. Lastly, please take some time to complete our survey for this presentation. You can scan the QR code on the next slide, and there will also be an email sent to you after this presentation with the QR code or with the survey link. And additionally, if you attended any of the seminars in the past 2023-2024 season, we have a year-end evaluation survey for you, and you can find the QR code also on this slide. Your insights in these surveys help us identify areas for improvement, and they help us tailor the content and format and logistics for this year's 2024-2025 season. So thank you everyone so much. We do have a few more minutes, so you're welcome to scan the QR codes on this slide. And for the speakers, if you want to answer any of these questions by typing, you're welcome to do that as well. But that concludes the presentation for today.
Thank you so much, Signe, for the opportunity.
Well, thank you so much for coming.
Have a great day.
Have a great day.